Welcome to Prevention Plus Wellness, LLC. For the next few minutes, we'll be talking about research which supports brief and integrated prevention programs. A study which examined the longitudinal patterns of adolescent health risk behaviors found that multiple health risk behaviors are common among American adolescents, with less than 4.2% meeting all 8 health behavior guidelines studied, and over 10% of adolescents having 5 or more risk behaviors at the early age of 16. In addition, this research found that not eating fruit, vegetables, or breakfast, being overweight or obese, physically inactive, or smoking predicted future health risk behaviors. The authors concluded prevention targeting multiple health risk behaviors is needed. A review of research examined multiple risk behavior program efficacy and found that one session, multi-health consultations, and group sessions decreased adolescent substance use. The authors concluded that school-based interventions should target multiple health behaviors because those types of programs are effective and an efficient way to decrease youth substance use. Now, let's take a look at screening and brief interventions as evidence-based practice. A number of federal and international organizations support the use of screening and brief interventions as evidence-based practice, including SAMHSA, the Substance Abuse Mental Health Services Administration, which has identified evidence-based practice brief interventions. In fact, SAMHSA has identified a particular model of brief interventions called screening, brief intervention, and referral to treatment, or SBIRT. The Centers for Disease Control and Prevention support alcohol screening and brief intervention in primary care settings. The World Health Organization supports alcohol screening and brief interventions. The National Institute on Alcohol Abuse and Alcoholism highlights alcohol screening and brief intervention for youth. And the American Academy of Pediatrics supports substance use screening and brief intervention referral to treatment for youth. Lastly, the National Institute on Drug Abuse supports adolescent substance use screening for screening and brief interventions. All Prevention Plus Wellness programs use an evidence-based screening and brief intervention format, which includes 3 steps. Step number 1, youth or young adults are screened for their current health habits using a screening survey, and this is designed to increase awareness of young people about their health habits, including substance use risks, as well as protective behaviors, wellness behaviors like physical activity and sports, sleep, breakfast, healthy nutrition, and stress control. The second step is to provide feedback to participants using positive image messages, following a script, showing PowerPoint slides, and this is designed to cue positive future images of young people in the future being more active, fit, healthy, successful. These are unconscious images, and that's designed to increase motivation for changing behaviors. The third step in this screening and brief intervention format is to assist participants in setting and monitoring goals, not just to avoid substance use, but also to increase healthy behaviors. And over time, this increases self-regulation among young people, which is so desperately needed. In conclusion, research supports the efficacy of integrating substance use prevention with wellness promotion within single programs. Research also supports the effectiveness of brief interventions for influencing youth health behaviors. And lastly, Prevention Plus Wellness programs integrate substance use prevention with wellness promotion using evidence-based screening and brief intervention practices. To learn more, sign up for free prevention and wellness webinars and resources on our website, preventionpluswellness.com.